Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. I'm going to have a conversation with Dr. Martin Schreiber. He's a Chief Medical Officer for DaVita Home Dialysis, and he's joining us here on Health Professional Radio to talk about kidney disease in general and some of the advancements in home dialysis care. Welcome to the program, Doctor.
Thank you, Neil. It's really a pleasure to be here.
Of course, Chief Medical Officer for DaVita, a bit of background about yourself for our listeners.
Yes, thank you. So I did my training at Mass General Hospital in Boston, Massachusetts, and then was a faculty member at Cleveland Clinic and spent my career at Cleveland Clinic and was chief of nephrology at Cleveland Clinic Foundation before joining DaVita as the chief medical officer for home modalities 5 years ago. And the time sure has gone quickly. And I'm in charge of home dialysis for both adults and pediatric patients throughout the United States.
When you're talking about kidney disease, is that a general term? It doesn't matter how you got it?
Yes. So the term chronic kidney disease means that there has been an insult to the kidney, which most likely affects the filters of the kidney and the kidney's ability to function properly. And there is a spectrum of damage that can go on within the kidney. And you can have early stage chronic kidney disease, you could have mid-stage chronic kidney disease, and then you can have what terms end-stage kidney disease, which implies that the filters that are remaining are not enough to meet the demands of the body. So when you're born with approximately 900,000 filters in each kidney. And so there are a significant number of filters to start out with when we're a child, but then with diseases and different insults, you may damage them.
Now, throughout our lives, we're going to be using our kidneys. Do we always know when something is wrong with our kidneys? How do you know that you've got kidney disease? And who is at risk?
Great question. You may not know, and most people do not develop symptoms until they've lost 80% of their kidney function. And people that have hypertension, people that have diabetes, people that have family members who have had kidney disease really need to check with their doctor, have what's called a urinalysis performed, to check for any abnormalities in the urine, or have a blood test performed. That's a very simple blood test that can determine whether or not you have any damage in your kidney.
Is kidney disease more likely to affect someone later in life as opposed to, say, from birth to early adulthood and into their 30s?
Yes, that is correct. So as we age, we do naturally lose some of the filters. But typically you don't lose filters to the point that you are in jeopardy from the standpoint of carrying out your normal daily function. But you do experience some gradual loss over decades naturally.
Briefly, doctor, how does dialysis work?
Yes. Dialysis is a process which removes waste products from the blood and removes water. And waste products are generated in the blood from what we eat. So there are two types of dialysis, hemodialysis and dialysis. And hemodialysis uses a process where they move blood from the body into a filter, circulate it through the filter, purify it, and give it back to the body. Peritoneal dialysis is a form of therapy that uses a solution that's instilled in the abdominal cavity, and that solution draws waste products into it, and then after a period of time, that fluid is drained from the body and new fluid is placed.
When it comes to home dialysis, which type of dialysis is used for the home care, or can either or be used in the home?
Yes. So either peritoneal dialysis or hemodialysis can be used in the home. Peritoneal dialysis tends to be used by the vast majority of patients that do home dialysis, but there still are a number of patients that do what's called home hemodialysis. So both peritoneal and home hemodialysis are different than in-center hemodialysis, and it just represents where is the site of care taking place.
What are the benefits? I mean, there are obvious benefits of being able to do your dialysis in the comfort of your own home, but with so many people doing in-center dialysis, what is it about in-center dialysis that differentiates it other than the obvious from home? What are the benefits of both?
Yes. So historically, most physicians are trained in doing in-center hemodialysis. So that really is a form of therapy which has dominated the end-stage kidney disease platform over the past several decades. There has been more and more interest and more medical support for the benefits of doing the dialysis in managing your kidney disease in the home. Whether it be on peritoneal or hemodialysis, patients tend to have a higher quality of life, decreased overall hospitalization rate, and really early survival advantage for people dialyzing in the home environment. And so as more physicians get comfortable doing the procedure in the home, I think they're going to see more patients doing it.
How does DaVita determine the ideal candidate for home dialysis and the monitoring that accompanies that dialysis?
Yes, DaVita is, as you know, the largest provider. We follow more patients in the home than any other provider in the United States. And what we've learned is that educating the patient so that the patient is well informed and can enter into discussions with their physician is the best first step. So I would urge that all patients really understand what their options are, learn more about the therapy. But the first step is really getting the patient to be informed, because if they're informed, 30 to 40% of those patients will feel comfortable doing it in the home. And now with the innovations that have been developed by DaVita, where we monitor certain biometrics in the home, which are like blood pressure, weight, and temperature. We have access to the devices data that verify how well the patient did on their dialysis procedure, as well as now the ability to do virtual health or telehealth visits with the patient. And so that level of connectivity really has taken away the isolation that a lot of home dialysis patients did not like in the past, and made more patients super enthusiastic about now feeling confident that they can really do the dialysis in the comfort of their own home and achieve a higher quality of life, in my opinion, Neil.
Does DaVita also offer extensive education and support for the caregivers who will be in the home taking care of the patient with some of their other needs?
Yes, we do. We're very dedicated to educating both the patient as well as the entire family. And we have had a large number of home classes for patients that occur all over the United States. And both the patient and the family member are always invited. And you can even go to these classes more than once. So we believe that education, not only to the patient, but to the family member, the caregiver, is absolutely critical. And in your journey with end-stage kidney disease, the caregiver plays a key role because, as you probably know, kidney disease affects not only the patient, but it also affects the family at large. So everybody being on board, and it's almost like I view the family as the lifeline to the patient. So I always encourage family members to come with the patients when they visit the physician, participate even in the virtual visits that we have with the patient, so that everybody understands and buys into the plan and is committed to the very highest quality of care.
Where can we go online and get some more information about DaVita Home Dialysis?
The best site for patients, family members, and professionals is really DaVita.com. And that has an extensive educational material related to kidney health, treatment options, avoiding risk complications, and the role that the patients really play in their overall health. But it's DaVita, DaVita.com.
Well, I thank you for joining us on the program. It's been a pleasure. Thanks for coming, and I'm hoping that you'll return.
Neil, it's been my pleasure, and thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.